Hi everyone, and welcome to the 9th annual CR Arthritis event at the CRA and AHPA scientific meeting that happens annually. Today I'm joined by Dr. Kwok, who is a resident in rheumatology at the University of Toronto. And his research is looking at the quality of care in gout, which he gave a presentation on earlier today. So with that, welcome and thank you for being here.
Thank you for having me.
And we're going to start off with a question. Can I ask, how are you involved in rheumatology and maybe how you chose this specialty? And kind of what is your area of research or specific area of interest?
Yeah, so I was involved in rheumatology when I had the honor of participating in a CRA summer studentship during my second year of medical school. And I really liked how, you have the blend of acuity, chronic disease management, developing of longitudinal relationships with patients, and really immersing in the community. So I carried that interest into my internal medicine residency training and now in adult rheumatology. And ultimately, my clinical as well as research interests lie in crystal arthropathies, including gout, as well as quality assessment in the rheumatic diseases.
Amazing. And I do agree that rheumatology is the place to be. Can I ask then, in your kind of interest area in that quality development, can you speak a little bit more about kind of specific projects that you've done or what you want to examine more in depth?
Yeah, so I think, the disease of gout marries those two concepts very well. It's kind of nowadays a more neglected disease amongst rheumatology. And it's fascinating because it's one of the few diseases that has proven therapies that are cheap, readily available, relatively well tolerated. But the main issue is getting getting those treatments from the patient's perspective, from the health services perspective, and continue on that treatment. So I think the area of research is really in the health services realm, both with kind of educating providers as well as patients on gout as a disease entity and the importance of treatment. So I think that's where maybe my career can really cement itself into really improving the lives of patients.
Amazing. And specifically, what are some of those quality measurements that we can use to kind of understand if somebody is going through with their gout care?
Mm-hmm. So we know from kind of the health services model, there's processes of care and outcomes. So within gout, the most heavily endorsed quality metrics were from the American College of Rheumatology, published by Fitzgerald's group. So they really endorse quality metrics in gout care. So specifically from our research perspective, we were interested in evaluating whether patients had a serum urate level monitored within 6 months of starting a therapy called urate-lowering therapy. And that is important because it helps the practitioner titrate or increase the dose of the drug in order to meet clinical targets. So, quality metrics exist within this disease. Quality assessment is an emerging area, but I think down the line, knowledge translation and filling that quality gap will be most important.
Awesome. And for everyone, could you explain what serum and then urate means? So what is that measure and how do we take it?
So we know gout results when there's a high level of urate, which is metabolic product of purine, is in the blood. So when it reaches a saturation point, then it crystallizes into the joints. And we all know someone in our family who has gout. Very painful disease, and recurs, and equally importantly, is associated with other diseases like a canary in the coal mine, like heart attacks, strokes, peripheral vascular disease, etc. So we know that we have drugs that decrease the level of urate in the blood, and that subsequently decreases the chances of patients having these painful attacks, and thereby there's emerging data, not as strong, about these bad cardiovascular outcomes. So, hopefully that explains a little bit of the concept of the treatment paradigm and kind of where along our research is.
Yeah, and serum meaning we get a blood test for it.
Exactly, yeah.
Okay. And then you talked about some of these therapies, and I know of a few. Talk us through kind of what is standard for, so say I come in as a patient.
Mm-hmm.
I present with the symptoms of pain. you diagnosed me as somebody with the condition, and then what is kind of standard care or best practice for this treatment, and how would you follow up so that you ensure that I do actually adhere?
Yeah. So I think there's two approaches in gout treatment. So one is treating a flare, and the second is preventing the flare. So I want to make the distinction that not everyone with gout needs to be on those long-term managements. There's specific indications for those long-term therapies. So if you were having an acute flare, number one, most difficult parts clinically is actually identifying that flare, because it can masquerade as other things like infection, other diseases, right? The area that we're interested in are those medications to prevent further flares. So the idea around, how we approach a patient is, if we decide that there's an indication to start those medications, we would start at a low dose to see if the patient tolerates it, and use the urate monitoring in the blood, so through blood work, to guide the titration or increase in the dosage of the medication until we meet kind of endpoints or kind of treatment targets, which is a urate level in the blood below a pre-specified level that studies have shown will decrease the chance of gout attacks, etc.
So it does seem like this, again, this approach that is individualized, because you're measuring the patient's level of blood urate, and then you're going through this process of calculation, like how much of the medication are we going to give, so that we can bring that down to the pre-specified level.
Yeah. And, the vast majority of gout is treated in the primary care settings. Of course, rheumatologists are involved when the situation is a little bit tricky in deriving the diagnosis or in managing the treatments. But I think, the main message from kind of the research that we've done to date is hasn't been done to the level where we want to. And I think there's still a gap in how we treat patients. And most importantly is thinking of ways to narrow the gap in the future.
Amazing. Can I ask, what do you think, or what should be a first step in narrowing that gap of ensuring that we are following through?
Yeah, so in our data, we found some disparities between especially prescribers in how they monitor urate. So we see rheumatologists and their patients having a urate test 94% of the time, compared to family physicians peaking around high 60s, low 70s. I think that, amongst other factors in our modeling, the main question is, why is this happening? And going kind of into the root causes of why this is happening. And I think that will be the formative stage in trying to address these deficiencies in future projects.
Awesome. With that, do you have any pieces of advice for a patient that perhaps is experiencing pain, or they have gone to their family physician and perhaps weren't given, blood work requisites? Should they start a conversation with their perhaps family care provider, or ask to go get a referral for a rheumatologist in this case?
Yeah, I think there's two parts to this. Number one, I encourage patients to read upon kind of credible scientific resources. So there's plenty from the American College of Rheumatology. There's networks amongst gout providers in the United States to try to educate themselves on this disease, because ultimately it's a chronic disease and it's not all just about medications. Medications form a crucial part of it. The second part is that I think there needs to be some outreach from our end to perhaps kind of share our knowledge and the current practices with primary care providers, so then they can ultimately benefit the most patients, their patients that they see in their practice.
And with that, thank you to the audience, and we will ask if anyone has any questions at this time to please submit them.
Do you have any self-care techniques for treating gout?
In terms of, you mean if someone has a flare, to how to abort the therapy?
Or how to alleviate the pain that they may be experiencing?
Yeah. So I think, my best piece of advice is always visit your care provider, because it's often sometimes difficult to tease out between gout versus something else, particularly if this is the first episode. If this is kind of a pattern of similar episodes, some providers do a pill in the pocket approach where they give pills, whether most commonly used medications, colchicine or anti-inflammatories. Of course, I advise patients to visit their physician because there might be contraindications to these medications. Where at the sign of a flare, they take the pill to try to abort it at the earliest onset. And secondly, I think adopting a healthy lifestyle as per the Canada Health Guidelines in terms of exercise, in terms of food, staying hydrated is very important because we know that gout is a harborer of other diseases such as diabetes, hypertension, heart attacks, etc.
All right, with that, then let's give a huge round of applause to Dr. Kwok, and thank you to our audience for joining us, and we hope to catch you again at the CR Arthritis event. Bye for now.